I'm Dr. Judy Gooch. I am a rehabilitation doctor, and on this YouTube channel I have a lot of videos on how people who have had a brain injury can improve. And today I'm going to tell you the story of Jennifer, who had a brain injury. About 5 years ago, Jennifer was in a car accident. She hit her head, she lost consciousness. She was flown to the hospital where she stayed for 4 days for an injury to her brain. After she was discharged, she did some cognitive therapy for a few months. Well, I first saw Jennifer a few months ago. Since her injury, she'd continued to have headaches, memory loss, difficulty with attention and concentration, and she was highly irritable. She had anxiety, and sometimes she even had panic attacks. She didn't have these struggles before the accident. Also, after the accident, when she read, her vision began to blur, and this triggered her headaches. Her biggest problem was the struggles she had with memory and concentration. She stopped cooking because she was burning things and because she forgot to turn off the stove. Often, she couldn't think of words to say, and she had difficulty remembering conversations. Jennifer was able to continue her job, but only because she had done the same job for many years prior to the brain injury, and it was familiar. She didn't need to learn new tasks. She didn't think that she would be able to learn a new job. After seeing Jennifer in clinic and hearing about her struggles, we suggested that she see a cognitive therapist. This is a therapist who works with cognitive or thinking difficulties after a brain injury. Often, it's a speech therapist. Occupational therapists and neuropsychologists can also do cognitive therapy. The therapist saw Jennifer and gave her strategies to avoid overstimulation, and this helped her headaches. The therapist also taught Jennifer tactics to improve her attention and memory. She also learned ways to compensate for her memory difficulties. Jennifer also started some vision therapy to improve her vision when she was reading, and this helped her headaches. We started Jennifer on a stimulant medication. After brain injury, stimulant medications can improve attention. Some people use them for just a short period of time, and others use them for longer. Jennifer also began exercising. She walked each day and went to the gym twice a week. Exercise has great benefits for the brain. It promotes the growth of new brain cells. It improves attention and memory, and it decreases anxiety and depression. Jennifer improved a lot with these interventions. She still has memory struggles, but her attention has improved. She's less irritable and less anxious, and her headaches are much less frequent. You might have been told that you can only improve for a year after brain injury, or maybe 2 years. This is not true. If you continue to work at it, you can improve for years. Our brains have plasticity and their ability to change and grow, but it takes work for this growth to happen. So, if you want to improve, continue to work. Look for providers who understand brain injury, who can guide you, and never quit trying.